Welcome to Ask the Expert. I'm here with Dr. Anand Budi, a pediatrician at Opal Court Pediatrics. We're talking about children and migraines. Welcome.
Thank you.
What is a migraine? How does it differ from a headache?
Migraine is a type of a headache,
Okay.
but it's much more intense, and it varies with age group. In pediatrics, it can happen with intermittent frequency, but it's very disabling as opposed to a headache. The statistics show that about 15% of all pediatric patients, by the time they're 15 years of age, would have a headache, which is typically a migraine.
All right. What are some symptoms of a migraine?
Most patients have aura, which is what they have a feeling that it's going to come. So it could be sensory aura, where they have various smells, or it could be auditory aura, which is they hear things. It could be visual aura, where they see flashes of light or dark spots, and then the headache can happen few minutes or few hours after that. Typically, aura is not a presentation in pediatrics. It's seen mostly in adults. The other features of migraine are they are nauseous. They can have vomiting. You can have significant headache, which can be very disabling.
At what point do migraines need to be addressed medically? Is it when they're happening every day or twice a week?
That's a good question. The reason why one gets diagnosed with migraine is if they have intermittent frequent headaches. So once the headache takes a frequency where it's disabling, either for activities in school, sports, socially, it does need medical intervention. Migraine doesn't have any diagnostic test, like you can do an MRI or a CAT scan. It's based solely on history and what your physical findings are. You have to do further testing in those patients because it may be atypical, or it could herald an intracranial problem like a brain tumor. Vast majority of kids, it's not common. In pediatrics, the cause of headache as a brain tumor is less than 0.4%. So that's very important, because anytime there's a headache, the parent always feels that it's a brain tumor. So you don't need to investigate extensively. First, you need to take a good history as a physician or a medical provider, and then go with the history, how frequent it's happening. And based on that, we decide what kind of treatment.
When should a parent realize it's more than just a headache, that the child can sleep off or take an aspirin and be fine later? At what point should they call the pediatrician and say, I really think there's something wrong?
In pediatrics, we generally don't advise giving aspirin to kids, because most often aspirin, especially during the flu season, can lead to serious problems like Ray's syndrome, which is a liver damaging illness. Secondly, if the headache is frequent enough that it's causing problems with the school performance or child's performance, then the parent should seek medical advice. So anytime the migraine is disabling, which means that it actually makes the person not perform their activity, it is important to seek medical advice. The reason why that's important is because most migraines in kids would get better when they sleep. So if they sleep and they wake up and they feel better, it's okay. You don't have to start with medication. There are other behavior modifications or lifestyle changes which we can do to improve that.
Okay. And how do you treat a migraine?
Basically, as I said, lifestyle changes which involve regular sleeping. They should sleep at the same time, whether it's weekend or weekdays. Even if the child can sleep late during the weekend, I generally advise them to wake up at the same time when they wake up on the weekends, take a small glass of juice or something, light snack, and then go back to sleep, which will decrease episodes of migraine. It's very important to eat regularly, not go hungry or miss meals, because that can be a trigger. In teenagers, I advise against smoking, because that's a very major trigger for migraine.
Okay.
So those are some of the lifestyle changes we talk about, but it's a much more extensive aspect which can be covered in a short time. And then there are medical treatments which include acute management, which are non-migraine specific, which is like acetaminophen, which is commonly known as Tylenol, or ibuprofen, which is Motrin or Advil. or naproxen, which is a leaf. And then there are migraine-specific medications, like most commonly heard as Imitrex or Zomig. And then there are preventative medications. If the child is suffering from frequent migraines, it's advisable not to use these medicines, because medication overuse headache is again a problem. And it's very similar to migraine, and it becomes very difficult to treat. So then in those patients, we suggest using preventative medications, which are numerous, and some of them are anti-seizure medications, and some are antidepressants, which are useful in that.
Great. Thank you so much for coming in.
Thank you.